Hi, Leo.
Hi, good morning.
Morning. How are you?
Good, good.
Cold out there.
It is cold, right? I was out at 6:30. I just want to give Carrie, in case she doesn't have co-hosting, give her co-hosting. Yeah, it was pretty cold, right?
Mm, I'm ready for spring, even though it's only January.
It's funny, right? And then it gets really hot in August or September these years, It's
Mm,
funny how the weather patterns have changed.
hmm
Trying to get my thing to work here. I keep getting to it, Carrie, and then it keeps like knocking. It's like bizarre. I got to tell you, um, it's the weirdest thing. I get there and I'm about to do it, and it jumps away. Okay, there you go.
Okay, great. I can start
Yeah.
doing the waiting room.
Great. So I can't believe it. Yeah, it's got a good early turnout, and usually people are early though. I mean, sometimes I'm late, not late, but it's been
Lots of interest around the vaccine.
Yeah, and it's amazing. There was an article in the Globe that I thought was interesting because, we're supposedly in the middle of the pack in the country, but when you think about the volume that's gone out already, we're over 150,000 vaccines distributed. So Vermont's ahead of us, New Hampshire, you know what I mean? But it's when you look at the population, our population's similar to New Jersey and Indiana, and New Jersey's behind us. So, but
That's a good.
yeah, so
Yeah.
it's a new. I mean, it's like somebody in the article said it's like dropping furniture off, but you have to put it together, and it's sort of like that's what they're facing.
Yeah.
And they also had no idea like how many people would be covered with the federal piece in our world, in terms of organizations that provide services, congregate care services in our world. So, and it turned out the federal piece that they did a little extra work on picked up only 20% of the congregate homes. So those are the kinds of things that until they know that, they can't totally put together a plan that makes sense in our world as well. So, but yeah, I mean, it's interesting. On the one hand, there's people that are nervous about getting the vaccine. And then there's a lot of us who are dying to get the vaccine, not dying, you know what I mean? We want the vaccine at ASAP, and it's that dynamic, that's, oh, hey, I should pull up my PowerPoint. I just. Get that up here. And Carrie, I'll send you a link to this one. I should do that right now.
Okay.
Because I don't think it'll change much. I have two versions. One's on the internet. Oh, this is the one on the internet. Okay. So actually what I should do is give you a link to it now, so I won't worry about it later. I'm going to give it to you right now. Okay, copy. Okay. Oh, that's great. Okay. Carrie, thank you. I just saw your email. So Carrie's on. Yeah, interesting. Because I just actually gave Phil Andre's number because it had changed.
Yeah.
So
Yeah. No. Oh, hi, Leo. Sorry.
that's a funny coincidence. Yeah.
Yeah.
I just saw it. Yeah, I just saw it, Carrie. Yeah.
I just want to, it's okay to talk to Phil.
Okay, thanks. Yeah, I didn't get into, I had no idea about you because he didn't know, your email just got to me. I just, all I did was share the number with him.
Andre lives right down the street from us, it turns out.
You're in Situate?
We are. Bobby rides his.
Oh, I didn't know that.
Yeah.
You know why I didn't know that? It's funny. I think your residence never came up. And then when I thought of Bobby, I thought of Southeastern Mass, but that doesn't mean that's where you live. Yeah. So that's.
Well, we were in Central Mass and then he was in school in Southeastern Mass, but now home is Situate.
Okay, cool.
Okay.
Well, it is nice to be by the water.
Oh, It's wonderful.
you know? And we're at 12 o'clock, so,
Yeah, people are still coming in fast and furious.
all right, so I'll wait a couple of minutes, you know,
Chris Thompson's on, so that's
no, I
good.
saw, I want you to know in advance, Chris, I had no idea if the Czar Chris would be around because well, I don't want to put out too much. He has a big life change coming up. So,
No baby yet, Leo.
no baby yet. Okay. But so I knew someone was going to be on, but I didn't put your name down, Chris, because I wasn't sure who would join Jane. And I know Jane might not get on till later. The commissioner may not be able to get on.
Yeah, she'll join us in maybe around 12:30 if you all are still
Great.
on.
We'll be on.
Conflict
Yeah.
till then, and then Liz Sandblom from our team is also on.
Oh, great. Okay, so, and then this time, I learned a big lesson. It turned out we had a really good interview with a DSP in May, but we couldn't use it in a video we're trying to put together because Leo didn't realize he should get out of the PowerPoint when people are talking and you don't need the PowerPoint. So new lesson learned. It's unfortunate. And she was in her residence and she had the garb on, but you can only see her a little. So we'll figure today maybe Carrie can even keep me honest. All right, well, why don't we start? Even though people are still coming on,
Yeah.
Carrie, I'd like to start so that we have
Yeah, we have 48 people on so
Yeah.
far, so that's
So
good.
I just will introduce Chris and Liz in a little while, but I'm going to just go ahead and do the normal beginning first. And it's,
Leo,
yes,
Rockton Arc is on.
yeah.
Yeah, how you doing?
Oh, good. Glad- Yeah, that's great. Welcome. And I know Dean's usually on quite a bit, so, but welcome. So someone's got the radio on or something, so just FYI, but I know, Carrie, you can mute all if you need to. So
Yeah.
the virus is up by 13,000 more than the previous time I reported to you last Monday. It's 45,342. The numbers increased by that much. So that was, and we were worried about that, right? Post-holiday, post-New Year's. And of course, the surveillance testing boosts up more, right? When there's holiday time, this sometimes impacts surveillance testing anyway, right? In terms of the holiday days and what's going on. So this is the first full week without the holiday you're looking at from the 9th to the 2nd, okay? And that means we have a total of 413,329 people. And the number of people who died rose by 639, that's unfortunate because for a long time, for weeks during the surge, we were not seeing a huge increase. And then slowly we started to see the numbers ramp up. And this is 155 more than reported last week. The USA totals, I'm not going to give you a contrast only because I didn't have the time. Sorry. It's 23.3 million people have the virus, 354,000 deaths. And the highest per capita, Arizona is still knocking home runs there. It's been up on our list, I think, at least for 3 weeks. Idaho, Nevada, Oklahoma. So some newbies have joined the list for the top 4. And then California actually dropped out of the top 10. Not that you care, but I just, we were so used to seeing California. This is sort of the chart. You remember I had a big chart for those of you that have been with us before. I went with the small chart because it shows you a couple of things here. And as you can see, can you see my mouse here? Again, you're looking at how the numbers have gone up, right? And are hanging in there. And it looks like it looks like it's dropping, but it's really not. If you look at this is probably more accurate, right? And then this piece is by county. It's showing you the impact. So, okay.
Very little on the west.
In congregate care, we have 236 cases in the private sector operated system, and 1,788 have recovered, and there's 31 out of 1,042 people. And so what I'm hearing anecdotally is people are saying one person's getting it here, one person's getting it there. So there's quarantines going on, but not the way it was during the first surge where entire homes would have it. And we're looking at a we're looking at a percentage of people impacted is 3% in the private sector, 2.9% in the state operated system. And so if you put them together, you're basically at 3%, 2.95, whatever you want to call it. Probably would be closer to 3% because I went downwards on the state op numbers. And you can, again, when you get this, you can always look yourself with the links we provide. And this is the actual chart that's showing us the community side. At Hogan, I think we're still at around, you're not going to see the Hogan institution there. They're still at around 8 people who have the infection with a bunch of staff. And then more staff, you know, the numbers are higher for staff. And then Rentham has higher numbers for staff, but still reporting under 5 people. So, and again, you know, it's not like the first surge, but you can see the numbers from the past, who's recovered. There's 1,788 out of 7,700 people in the private system and almost 200 out of 1,000 in the state operated system. So, and our priorities continue. I don't know what that is. Carrie, can you mute them, please? And then we still have our priorities, you know, that we continue and probably should move up, prioritize constituents for the vaccine. But we did get some great news last week, and I'm not going to take any thunder away from our guests from the Department of Developmental Services. So I'm going to let them tell you about some of the, new developments that just happened a week ago, both for the general public, but also for our constituency and for people with disabilities in particular in general. So it's pretty good stuff. So, and then this is the chart, which I can always come back to if Chris wants me to, but just again, sharing with you the priorities. And I just took this down over the weekend. So I think this week, Friday, the first responder injection started. But again, I don't want to get too far into it, but this is going to be available in your PDF when you get it. So you'll be able to see this as well. So I got Jane's picture here because again, I'm going to take this off screen and introduce those that are with us. And obviously Commissioner DDS will be with us later, possibly. Looks like close to 12:30. She had a meeting that started at 11, so we appreciate that. But I want to introduce 2 people from the department who I think very highly of, and some of you may know them already. First, I kid about this title. I'm going to introduce Christopher Thompson, who's technically Chief of Staff, but I call him the Surveillance and Vaccine Czar, but he's about to give up those titles. And sometimes he likes it and sometimes he doesn't when things aren't going as well as he'd like. So, but he's been really very communicative. He's somebody who tries to keep things going in terms of not only communication, but implementation. So I appreciate all the work you've been doing. And Elizabeth Sandblom, who's, I want to say Assistant Deputy Commissioner. Am I saying that right? And I'm very thrilled and was thrilled when she became person who's overseeing self-direction, among other things, by the way, a lot of other things, but working with Tim Cahill in terms of operations of the department. And we've been engaged together on working on with Margaret Van Gelder and Kerry on those videos for charting the life course. So there's a lot of areas that Liz is in, including, implementation around the vaccine as well. It's all hands-on. So it's a pleasure.
And I just inadvertently gave myself an upgrade. I'm the Deputy Assistant Commissioner, not
okay.
Assistant
Sorry
Deputy
about that. That's Leo's fault. That's you were just shaking your head up and down. It was cool.
I know. It was great.
I know, and you know me, how I stand on ceremony a lot. So I should know these things really well. Anyway, just it's great to have you with us, and obviously Commissioner Ryder when she gets on as well. How do you guys want to do this, Chris? Do you want to start? Or okay, great. Welcome, Chris, again, and really a pleasure to have you with us.
Thank you, Leo. It's good to be with you. And as I say that, could you tell me who's, I know we had a couple options to join meetings you had, but who's on this call? I recognize Carrie.
No. So this is a broad-based call that's intended for families and individuals with disabilities, but it also includes staff that come on as well. But it's might be staff that, or house managers. That's happened. I've noticed program managers have come on, senior staff have come on. Mike Maloney's come on, historically almost every week. So it really all depends on, there's a whole range of staff that might come in, but it's heavily family and individuals with disability, but it's also, I'd say, I don't know, 20% staff, 25% staff, something like that.
Great, thank you. That's helpful context as I talk about what's going on with the vaccine, and I appreciate, Leo, you setting the table with what's going on with the pandemic generally and the numbers there, because it really does, it provides the context, of course, for what we're trying to do, which is a huge undertaking of vaccinating the people to the extent possible in our whole DDS system, and so I hope to be able to share some new information with you all on the phone here, and this is happening, as you can imagine and as you see in the news, very rapidly. So I'll just kind of go through some things that I want to talk about, and then I'm happy to answer questions as well. So, as I think you all know, this is the largest and most significant vaccination effort in history. Certainly the first of its kind for anything that we've tried to do in the department. We try and get people their flu vaccine every year, but nothing at the scale of what we are now pursuing in terms of vaccinating with both the Moderna and Pfizer vaccine, now that they have been received their emergency use authorization. So if you haven't seen this, last week the governor announced, as Leo showed with the graphic earlier, Massachusetts is taking a phased approach to the vaccine rollout. Some states kind of put it all out there, and I think I was reading an article about the kind of chaos in Florida right now, who tried to make it available to everybody, and now it's very hard to actually find a place that you can get vaccine. Massachusetts is taking a very deliberate approach in terms of phasing in the vaccination and having an infrastructure in place to vaccinate as vaccine becomes available. So Leo showed a good graphic, which is updated by DPH very frequently, that shows how that phased approach would work. So the first phase one, includes several categories. The first category is healthcare workers in COVID-facing work. So this is really your hospital workers and the people working directly with folks that have the virus. And so that started the middle of December in Massachusetts with the rollout of the Pfizer vaccine as soon as that was received its emergency use authorization. The next group was long-term care, which would be nursing homes, and in Massachusetts, as across the rest of the country, we've really seen the most adverse impact in terms of deaths and people suffering significant side effects in nursing homes. So those were prioritized across the country and also in Massachusetts. So those are largely being done through a partnership that has been organized by the federal government called the Federal Pharmacy Partnership Program. So CVS and Walgreens have been have a relationship with the federal government and for all of our long-term care facilities. And I'll get to this later, a portion of the DDS system through congregate care, they are getting vaccinations through CVS and Walgreens as part of this federal initiative where the feds pay for everything and CVS and Walgreens handle a lot of the logistics. But when it comes to the DDS system, we are really, and then the third on the list is first responders. So that starts today. You referenced that, Leo. There are a bunch of sites throughout the state where cops and firefighters and EMTs are today starting to get their vaccinations, and that's really important. And then next Monday, the week of the 18th, we will start with vaccinations to congregate care programs, which includes all of our DDS and IDD and ABI, all of our group home system, and also DMH group homes and DCF group homes. Kind of anywhere there are people who are receiving, who are living together and receiving 24/7 care would be included in this residential congregate care system. So that we're talking about. And so we're excited that that can begin January 18th. And then after that, in early February, there is the next group on the phase 1 list is home-based healthcare workers. So those include our shared living providers, home-based respite, individuals, family support, adult foster care, PCAs, a bunch of types of programs and services that really are largely representative of our DDS system. And Liz knows way more about that and can certainly answer questions. She's been our lead on that home-based healthcare worker initiative. And then phase 2, which begins at some point in February. The first category there will be individuals with 2 or more comorbidities, and anybody over the age of 75. So again, that I think especially the individuals with 2 or more comorbidities impacts maybe even most of the individuals served by DDS. And so that will be sort of a different distribution method where I think people will be able to work with their primary care physicians and the people who are their kind of day-to-day healthcare providers, if they're, say, living at home or in a setting, living independently but not living in a residential congregate care. They may be able to, hopefully by that point, we are developing this infrastructure a little more every day. And I hope by the beginning of February, which is 3 weeks from now, having done hospitals and then long-term care and then first responders and then congregate care, we're just building this. We're building this infrastructure for vaccination that I think will be in place and really helpful to the groups that come after. So that's kind of an overview and how the phased approach will work. And they have all of those determinations, I should say, were made by an advisory group that was put together by the governor in representing the different communities and constituencies, and with a real lens towards equity. And so in the past week or two, we saw that everybody over age 75 was added to that phase 2 category. That was something not in the initial release. And I've got some helpful links I can share with this group too, where each of those DPH has done a lot of good work over the last couple of weeks defining each of those categories I just talked about. So when we say home-based healthcare workers, what does that mean? There's a lot of additional information about what exactly has been included in that list, and we can share that with you. So the next thing I just want to mention is about vaccine safety. And I know that this people have a lot of questions about vaccine and concerns. So I do want to share some information that is true of both the Pfizer and Moderna vaccine for you as people who represent our system and our strong and important voices. We really we want to educate you and for you to have the tools to educate others so that this is successful and that folks get vaccinated. So the vaccines that we are now distributing in Massachusetts, I'll slow down a little bit, are the Pfizer and the Moderna vaccine, which have both received an emergency use authorization and determined to be safe by the FDA. So the vaccines go through more testing than any other pharmaceutical, including extensive testing and clinical trials. The FDA and CDC's Advisory Committee on Immunization Practices ensures that the vaccine is both safe and effective. And we also, in Massachusetts, took it one step further and had a task force which provided an independent, non-governmental evaluation of each of the vaccines. And they were both determined safe and effective, and unanimously recommended by the task force that the Commonwealth deploy those vaccines for use. So that's both the Pfizer and Moderna vaccine. And so I think that those are all important things to keep in mind. And you may have read in the past couple of weeks about people having allergic reactions, and whenever there's a vaccine that's been administered, we want to think about what the ingredients are and whether somebody has an allergy to one of those ingredients. People may have a history of anaphylactic shock after taking a vaccine. So part of the requirements of administering the COVID vaccine are that you need to report on moderate and severe adverse events in the reporting system. So anytime someone gets the shot and something bad happens, either mild or either moderate or severe, then that needs to be reported. And that's a really important part of this process, as more vaccinations are happening. We're learning more about the impact those vaccinations can have in the safety and considerations that need to be taken. So that's background on the vaccine itself. Through the next step is, and once we have a vaccine that we determine is safe, the next part, and this is really also challenging, is figuring out how to get people vaccinated and how to deploy the vaccine. So I mentioned before that there was a federal initiative, the Federal Pharmacy Partnership, which matches long-term care sites with CVS or Walgreens, and then they handle all of the logistics. We actually are very fortunate, and maybe we slipped through the cracks or snuck in the side door, but a portion of our DDS programs, we actually had them all apply earlier this fall when we didn't know much about this program, but we thought it would be useful. We had our DDS residential programs apply to as though they were a nursing home. And a portion of them actually were determined eligible by the federal government. So CVS and Walgreens are for around 20% of our programs in the DDS residential system. CVS and Walgreens are going to treat them like they would a nursing home, and they're going to show up, do the vaccinations. Some of you on this call may have a family member in a home that's or a program that is part of this, and so you may have been asked to fill out a consent form that has CVS or Walgreens on it because they are the ones actually doing the vaccination. So we're lucky in that a portion of our DDS system is actually covered through this federal initiative, but we have a big challenge in that the other 80%, the federal government is not solving for us. So we as a state had to come together and for our providers, come up with some options for them to pursue so that we can get as much of our congregate care system vaccinated as quickly as possible. So the options we've put on the table for providers, and we are pursuing others, but the initial options are that a provider, if they can meet certain criteria and have the infrastructure, can actually receive the vaccine directly. They have to have things like a freezer in order to store the vaccine, and they have to have a medical director or some other physician or nurse practitioner who's associated with the program who can write a standing order. But one of our programs wouldn't normally, I don't think, receive a flu vaccine and do it for the residents, but this is a unique circumstance. So we are allowing, DPH is allowing providers to actually raise their hand and say, I'm capable of receiving the vaccine, and I want to run vaccine clinics and vaccinate the residents and the staff that are associated with me. And so we're for the providers who are in a situation to be able to do that, we're going to help them do that. So that's option one. Option two is that providers have ways that they have always done vaccinations through the flu vaccine and other kinds of things that happen on a regular basis. And so we're asking them to think about how they do vaccinations in normal times, and then reach out to those people that help them get it done. And we will, the agency will work with DPH if that normal provider who's partners with them is able to receive it and can help. We will ask DPH to send them COVID vaccine in order to vaccinate the residents and staff in their program. So that could be a local pharmacy. It could be big or small. It could be just a local pharmacy or a bigger chain, pharmacy chain that they work with in the past. It could be a local hospital, a healthcare practice, community health center, university health center. And so we're asking folks to think about their existing partners. We also are in Massachusetts setting up mass vaccination sites that will be available for staff and residents of congregate care settings starting next Monday. Well, I should say that I'm not sure when exactly the vaccination sites will open. I think that they're getting those contracts in place, but they will be some geographically distributed across the state. And so individuals who are living in congregate care, if they're able to ride there, I think they will all be appointment based, so that it's not like they're waiting in line for hours and hours. But those mass vaccination sites will be an option for our congregate care providers, and then afterwards, those mass vaccination sites will stay up and be available for anybody throughout the system to go and get vaccinated. And just one other or a few other things to think about here. One is that for both the Moderna and the Pfizer vaccine, it's a two-step process. So you get one shot, and then for the Pfizer vaccine, you wait at least 21 days and then get a second shot. For the Moderna vaccine, you wait 28 days and get a second shot. So it's recommended that everybody gets two shots, that they get the second shot from the same place that they got the first shot, and that if you got one vaccine, so say you get the Pfizer for the first vaccine, that you then get the Pfizer again for the second vaccine. So you keep it consistent. So that's one piece that we want, no matter what option you choose, to think about. And everybody who's getting a vaccination should, at the time of the vaccination, get a little card like you do with the flu that says, I got the Moderna vaccine, and here's the date of when my next dose will come. So that two-dose shot is something to think about. Another is that we, in looking at our DDS regulations, are recommending that folks that guardians sign a consent form, or it can be a verbal consent, or as long as you are talking to the people who are organizing the vaccination on behalf of your loved one, in giving your consent. It can be over email, but each of the pharmacies may have a different vaccination form, but we are recommending that guardians be given the chance to give consent for that. And I think that there will be much more information to come on this. We had a big webinar with DPH and all congregate care providers last week. This week, starting with this call, we are at DDS trying to do much more communication with our families around how the vaccination rollout will work, and when your loved one may be able to get vaccinated. But we will hopefully have much more to share soon. But the big piece of news I want to share is that the 18th will be when vaccinations can start for congregate care settings. That doesn't mean, of course, that everybody's going to get their their first shot on next Monday. But it is important that that is the date by which we can start this process. And we've got a big system with DDS in order to get people vaccinated. So it's important that we get going. Leo, that's I've certainly talked enough.
Thank you, Chris. Yeah, no, I had myself on mute. Sorry about that. Yeah, there's a bunch of questions, and Carrie can help me with the questions. And I think you answered some of them through the process of explaining the choices. You had told me at one point that mobile might also happen. Is that still because of you were concerned? You said some people, the whole waiting online thing isn't going to work, you know?
Right. So that is, I do want to, if somebody has been matched with CVS or Walgreens, in most cases, they will go to you. So I want to say that may already be happening in some cases. But for those that, most of our system, as I said, are not matched with them. So we've got to come up with another solution. We are pursuing a couple options for mobile vaccinations, but we're not ready to share the details yet, just because those are being finalized. So we totally, that is a good point, Leo. We want to acknowledge that not everyone can leave their residential program and get vaccinated. So we are very aggressively pursuing some options to have the vaccine be brought to people across our system who need it in the congregate care space.
So one of the biggest reactions we got, and it came up here too, and Carrie, if I'm saying it wrongly, correct me, was when it was posted on Facebook, some of the information we had up, and then we posted later in the week the public health thing about home health workers. That was really good news. It seems very broad from our perspective in a good way. Families who are caregivers who are not paid brought it up. And, obviously that's an obvious question. We've been advocating for a broader vaccine. What about family caregivers who are not paid, but you know what I mean? But play that role significantly, even when they have paid staff coming into the house.
So I'm actually gonna.
How are you? Welcome.
Yep. Hi, Jane. Jane just joined us.
Good afternoon. Good to see everybody.
Go ahead, Chris. Go answer that, and then we can.
Sure. So I'm actually gonna, as I said, that Liz has been much closer to the home-based healthcare workers. I wonder if that has come up in those conversations, Liz.
Yeah, thanks. It has not. However, I was following that on your Facebook post over the weekend. So I have that. I have a meeting right after this call. So I have that on my list, as well as I know there's been a lot of questions about day staff and day hab staff. So those are two things that I have to bring up today on our call. And I think I can't highlight enough about what Chris said about how fluid this whole process is. And to your point, Leo, about the broadness of the definition of caregivers going into people's homes to provide care, I think that was in recognition of how hard it is to capture every single possible scenario and group. So I think EHS and DPH are really acknowledging that task is huge. And so they're really looking at definition-based decisions. So people who are providing care into the, paid caregivers in the home was the definition, that broad definition that allowed us to be able to identify folks. So again, a lot of conversations, a lot of information coming in. And I'm trying to follow that, and I will bring up those two situations today at the meeting.
That would be great. And I just want to commend the commissioner and her team, just like the example Liz just gave, that she just was on the weekend on the Facebook page. Okay, so this sort of back and forth, not just with us but with others too, has been unbelievable. It's been real positive and continues to be positive. And I wish there was some magical way this all could get sorted out overnight, but that's not going to happen. It's going to take some weeks to have it roll out. Commissioner Chris did a great job walking through the steps, and we got some questions. I don't know if you want to say a couple of things to the group, just because you're and we like having you with us.
Well, first of all, Leo, I want to thank you for inviting us and Kerry. As I'm sure Chris has shared with you, as the Secretary Sudders constantly reminds us, this is the largest and most extensive rollout of a vaccine implementation in the history of the world. And she, and I believe the governor himself, often uses the word bumpy to describe the rollout. But these type of forums where we can get input from all of you and kind of, as Liz said, you know, there are always situations that we might not take into consideration as we're working with the command center and rolling out vaccinating everyone. This is so helpful for us. And it's helpful, I think, to you folks that we can have this type of dialogue so you can get the most updated information coming from the command center as regarding the implementation. And as I think Chris also mentioned earlier, things are changing like on not just a daily basis, an hourly basis. I'm very fortunate. Members of my team are very involved with the command center in rolling this out. And I hope you all know that we're available to, again, let you know what's going on as things are changing, as things are developing. We are committed to making sure that the people we support, our families and our staff, know exactly what's going on in this very, very complex rollout of this vaccine. So Leo, thank you for inviting us to join you today. And again, we're always available.
So we thank you, Commissioner. And Kerry, do you want to, I know people, what I don't want to do is repeat things that you guys are aware of now, right? That because you guys internally advocate as well. I know that, and I appreciate that. And it's the family thing has come up consistently today and on Facebook. The other thing, people in day programs, and you know, we had sent a letter in on that as well, sort of raising that a little higher because it's just to get people into the day programs, number one, right, and break that isolation. And that's something that one person says some other states, I think Dawn has said some other states, unpaid family caregivers are in A2, on phase A2. And that, that might be so. Massachusetts, I know, was one of a few states that went ahead and pulled the trigger on small congregate homes. And the reason, so there might be an order of how people are doing this that's different with other states. And the only reason I know that is because my Washington office called to confirm that Massachusetts was doing that because they want to be able to tell that to the Washington Post for national distribution. So,
but Leo, I actually thank you for bringing one of the things I was going to say. Like all of you, I watch the news every night to see how things are going on in other states, and like every day, I thank goodness I live in Massachusetts. When I see some of the pictures of, especially folks over the age of 65, 70, sleeping in their cars, waiting in lines to get vaccines. I mean, we're not going to see that in Massachusetts. And I think just the very kind of way of these phases, and yes, there's a lot of work to be done. There's a lot of input to be made. But I truly believe this administration in the state of Massachusetts has a heart and is listening to agencies like DDS, and also listening to all of you advocates who are advocating not only for your sons, daughters, sisters, and brothers, but you're advocating for the people that support them, and people are listening. So I think, once again, we're very thankful we live in this state right now.
So one of the things I wanted to share is Kathleen asked about the home health provider process, Liz. Is that being formed now, the strategy for it? Is that what you were saying?
Yep. So the announcement that came out on Friday was just, there's a lot of questions. Where do I fit in? Where do I fit in? So the announcement on Friday was really to let the group of home-based caregivers know that this is where you are. The target to get to that section of phase 1 is early February, but there are no firm timelines or processes as of yet. So that will be forthcoming, and that's sort of our next, piece of information that we'd be sending out related to that group.
And then the other question that's a pressing one that Lucy has asked a couple of times relates to what can providers do to be ready? Like it, you know, have all providers, you mentioned the consents, Chris, earlier in the conversation. Maybe we should emphasize that ideally providers, especially congregate care providers, and maybe even day providers, in the case that gets moved up, should be thinking about that too. But just to get permissions from guardians and whatever else is needed, because that can be cumbersome, right? Getting those, you said it could be a verbal authorization? I don't.
Sure, it can be a documented verbal authorization, yes. And the important thing here, though, is that there are 2 vaccines that have been approved. Currently, they're not exactly the same. So there's the Pfizer vaccine and the Moderna vaccine. We would recommend that if a provider is organizing, or CVS and Walgreens have very established processes for this, and a pharmacy, if they were partnering with a provider to do the vaccine, would likely have an established process here too. There's a fact sheet for each of those vaccines that every, the federal government, that as part of the emergency use authorization, they recommend that anybody who's getting the vaccine or their guardian just reviews the fact sheet. So that is in the, I can share a link that has the translations for those as well.
That would be great. Yeah.
But that just tells you, basically what's in the vaccine, so that, if you think, I have a complex medical history and I want to talk to my, primary care provider before I make this decision, that's okay. And that might be something you want to do now, though, before that date is scheduled, and knowing, but you would want to know which vaccine it is in order to do that. Or maybe it's, the beginning of a conversation as well, also, where the primary care doc can say, we feel confident, or, talk to me again once you know which vaccine it's going to be.
Well, that's really a great point, because I hadn't thought of that for some people, one vaccine may be preferable to the other for health reasons. So thank you. And we should put that out there, Carrie, huh?
Yeah, there's also just on our website, there should be under the COVID pages, a nurse sent us some easy read on the vaccine. So that may be another resource about to share with their loved ones, as well as, the folks living in homes and that sort of thing, just to educate them more about the vaccine.
Yeah, thanks.
We're also working on a social story that I hope we'll have by the end of the week that
Great.
You guys can add to your website.
We would love to. Couple of things on the Dawn presents that the nursing, some places are saying they won't administer the vaccine to their nursing staff or their home health staff. And again, I think what I'm hearing from Liz is things could change on that as information comes out about the availability to these agencies. And they may still keep that position, but they may change their position because it might turn out to be easier than they thought. Now, they might be fearing liability. I don't know. But it would seem to me that once the vaccines, because there's 2 pieces that Chris often says, it's the availability of it, but then there's how the hell do you administer it? Do you have the capacity to administer it? And there are a ton of these part-time nurses, by the way, that work in AFC and other programs that are there as a workforce if organizations want to work together on this. So I think that's important. And then Sherry asked if her child had COVID, and her child is an adult, obviously not a child. Could they still get the shot as scheduled, or do they have to wait 90 days because of the post-COVID?
So it's not recommended that anybody currently under isolation after recently testing positive gets the vaccination. Just to be clear, if somebody has sort of an active case of COVID, we would not recommend they receive the vaccine. There is a recommendation, as you say, Leo, that you wait a period of time after having tested positive before receiving the vaccine. But it isn't, if say you tested positive in April, we would certainly recommend that, since it hasn't happened recently in the last 90 days, we would recommend that anybody who, let's say early this spring, tested positive does now get the vaccine.
Okay. And then Hillary's put this up, and gave a link to where people can see the letter that there's been 2 sets of letters, one in general about moving our population up, and one that DLC and the ARC organized that has to do with the day congregate day settings and live at home. And she's got the link up there on the chat board if people want to see that letter as well. Both letters should be posted up there. The original from December 2nd, organized through CPR, and then the one, we stepped up a few weeks later about the congregate settings. I'm trying to look for Kerry, did I miss anything in terms of the question? I think some of the questions, a couple of similar questions about the home health that.
Yeah. I think, I don't think, so for some of the questions, I don't think there's answers yet, which I think Liz and Chris, really talked about, and Jane. And we have to have a little bit of patience, but, we're excited that we're getting good communication from you folks, and we can help deliver the messages, because there's so much to consider, and appreciate you, talking with us today. So.
I think the biggest takeaway, besides everything else that we just heard, which there's a lot to take away from today, is the whole issue. The thing that maybe we haven't thought about enough on our end is providers being ready, even if they don't know when the heck the vaccine is going to kick in, with those permissions, and helping make sure that if people have complex conditions or medical, any couple of comorbidities, that they know which vaccine's safer for them, Pfizer or Moderna. That to the extent that can be done now, would be great. Obviously, if someone's scheduled now, you got to call tomorrow or today to get that answer. I
do want to. I'm not a medical doctor, so I don't want you to interpret what I said as me knowing that much more about it in this case. I think that what I'm saying is that there is a slightly different makeup for both of the vaccines, and it's important, to be aware of that and to know. I did not mean to say that one is, necessarily safer for the other than the other. So it's a nuanced point, but I don't know enough about it from a medical perspective to know that statement is true. I think it is important that we be aware that there are 2 different vaccines that have, 2 slightly, different considerations. If that point makes any sense.
Mm-hmm. Yeah, you're saying it's more of a due diligence thing, I think.
Yeah.
You're adding, Chris, and I made it a little more than that. And I don't want to scare people by doing that. And I could have unintentionally done that. So thanks.
That's what I'm saying. I just don't, it's not like, I think that everyone who is administering this vaccine goes through a process and, is trying to be very conscientious about this, that people will be in most, if not all cases, kind of screened at the site of vaccination. And anybody who's giving a vaccination ought to be, if they're following the process laid out here, needs to be prepared to monitor people for symptoms between 15 and 30 minutes after the vaccine is given. And that's something that anybody who's doing vaccinations will know in advance and be prepared for. They will need to have an EpiPen on hand in case, epinephrine were needed in the event of an allergic reaction. So, if somebody is receiving or administering the vaccine, it's still a vaccine. If you've done the flu vaccine, the same considerations need to be met here. And also someone who's done flu vaccines will, for the most part, be prepared, for everything that goes into it in terms of, monitoring for symptoms and knowing, what to look for and being prepared for, an adverse reaction.
Okay.
And Leo, I just want to also offer regarding the congregate care, which is, as Chris said, going to be sort of in full swing next week, that our regional directors have been really, we've been providing a lot of information to them. They've been providing information to us, and they've really been in touch with their provider agencies. So I think that most of our provider agencies are aware of what's coming and have been really thinking about best way to support the individuals and reaching out to guardians and such related to the vaccine. So there's a lot of conversation going on at that level as well, just so people are aware.
Great. Just in closing, Dawn and someone else mentioned that some agencies are having to discharge patients in home health because they don't have enough nurses, because nurses are taking jobs with this COVID thing at a higher rate to do that work, you know, in terms of the vaccine and, or I'm assuming it's related to the vaccine. Yeah, based on her note. So that's a shame, and to test at COVID sites for higher pay rates. So that's again part of the whole workforce crisis we face, both in terms of nurses, but also in terms of direct support professionals. So it's always with us, it seems. You know, you can't get away from that. But you know, and that's even more praise should go to the people that do stick it out and hang in there with us. And there's such an essential workforce. So you know, so we do, yeah, we have a lot ahead of us. Thank you so much. I just want to again reinforce Kerry's thank you to Commissioner Ryder, Jane, thank you, Chris Thompson, Elizabeth Sandblom, a really awesome presentation. And it is what it is. It's a evolving process, and it's going to get implemented. We're going to be on the best side of this, hopefully within a few months, and in the right direction with it. And so thank you for being with us. And folks, feel free to communicate through Facebook and other forums, emails, whatever questions you have. And also we will share new updates as they come through. And just to tell you, I was in a meeting and Chris was editing one of the documents live that was posted on my SharePoint, my staff, as I was going through the document. And it was that's the kind of commitment and communication we all have. So I just want to thank you guys again, and thank everyone, all of you that have been advocating and supporting and do what you do as family members, as individual with disabilities, and as staff. So God bless you, and see you next week.
Thank you all. Good
All
to
right.
see everyone. Thank you.
Thank you.